Book smarts versus street smarts. In this video, we're going to review both and understand why they both are needed to become a well-rounded EMS provider. We've all worked with that salty partner who swears they've been there, done that, and seen it all. But have they really? The truth is, medicine, and especially emergency medicine, is a rapidly evolving field. What worked yesterday may be outdated today, and what you learned years ago might be replaced by new best practices tomorrow. In this line of work, both book smarts and street smarts are vital, and mastering both is how you stay sharp, stay safe, and provide the best possible care for every patient, every shift. In EMS, it's not enough to just have the book smarts or the street smarts. You need both, and you need to know when to use which one. The textbook will teach you protocols, anatomy, and physiology. The street will teach you how to improvise when the patient doesn't fit the textbook, when the scene is a mess, and when nothing goes as planned. The best providers balance both. They can rattle off the signs and symptoms of tension pneumothorax, and also recognize it in the back of a dark ambulance when a patient is trying to check out early. Book smarts guide your hands, street smarts guide your gut, and your gut is what often saves lives. Remember, no patient cares how many acronyms you can recite if you can't stay calm when it all goes to hell. The best EMTs have learned to walk that line, knowing when to slow down, when to speed up, and when to just trust the voice in the back of their head that says, "This doesn't feel right." In EMS, both matter. Book smarts can help you pass the test, but it's the street smarts that help you survive the call, and if you're lucky, get home at the end of the shift. In EMS, formal education and textbooks are where it all begins. This is where you build that strong foundation, the one you'll stand on when you're faced with a patient crashing in the middle of the night. It's more than just memorizing protocols, anatomy, physiology, and pharmacology. It's about understanding why you're doing what you're doing and knowing when to adjust when things aren't going by the book. That deep knowledge is what guides you when every second counts, and it gives you the confidence to make the right clinical decisions when the pressure is on. After all, patients don't always present like the textbook says they should. Sometimes it's the classic chest pain patient, and sometimes it's a guy claiming heartburn right before he tries to die in your ambulance. This foundation doesn't just help you pass a test, it saves lives. It allows you to assess quickly, think critically, and piece together the story that's buried in a patient's presentation. In EMS, knowing the textbook stuff is like knowing the map, and knowing the patient is like knowing the terrain. You need both to make it home at the end of the shift and to make sure your patient does too. In EMS, it's one thing to know the how, it's another to understand the why. That's where this knowledge truly shines. It allows you to piece together accurate patient assessments, making sure you're treating the patient and not just chasing a number on the monitor. It gives you the ability to justify treatments and interventions, not because the protocol said so, but because you understand what's happening inside that patient and why that medication or maneuver is going to help. This depth of understanding doesn't just help you when it's time for a test or a certification. It's what separates a technician from a clinician. It gives you the foundation to walk into a scene, assess quickly, make decisions with precision, and adapt when the patient doesn't fit the textbook picture. And when things go sideways, because in EMS, they always do, this knowledge is what allows you to adjust, improvise, and stay one step ahead. It's the difference between going through the motions and making a calculated, confident decision that might just save a life. In this field, knowing why treatments work doesn't just make you a better test taker. It makes you a better provider when seconds matter and the odds aren't in your favor. The things you learn in a classroom can only take you so far. The rest you pick up in the field, often at 3 a.m., when the scene doesn't match anything you've ever read in a textbook. This is where experience shines. It's how you develop the ability to adapt to unpredictable situations, to adjust when plan A goes out the window, and to recognize when the patient in front of you is about to crash before the monitor ever says so. Over time, you gain an intuitive understanding of patients, environments, and team dynamics. You learn to read a room the second you walk in, to assess a patient with a glance, and to work with your crew like a well-oiled machine. You'll make quick decisions under pressure, knowing when to slow down and when to move like the patient's life depends on it, because it usually does. Experience is the best teacher in EMS, and it doesn't always come from a book. It comes from countless calls, countless moments of what now, and countless nights where all you have is your training, your team, and a stubborn refusal to quit. In this job, that's what separates a technician from a seasoned provider, and that's what saves lives when seconds matter. In EMS, things rarely go by the book. You can memorize every protocol, every algorithm, every textbook picture, and still walk into a scene that doesn't fit any of it. This is where experience shines. It gives you the ability to think quickly, adapt, and problem solve when the pressure is on and the stakes are high. That means knowing how to build trust and rapport with a patient when every second counts, and using that trust to gather the information you need to save their life. It means making the scene safer for yourself, your patient, and your crew, and making the best use of the resources you have. Sometimes that means making do with a less than ideal situation, a tired team, and equipment that's seen better days. More than anything, experience gives you the confidence to adjust when things don't go as planned. Because in this job, the unexpected is the rule, not the exception. The best providers don't just memorize protocols. They understand why they matter, when to bend them, and when to toss the book out the window altogether. In EMS, it's not about knowing every answer. It's about knowing how to find it when seconds matter and lives are on the line. Book smarts and street smarts aren't competing ideas. They're two sides of the same coin. Book smarts are the why. They're the academic knowledge, the protocols, the pathophysiology and pharmacology that tell you what's happening and why it matters. They're the foundation, the thing that gives you a roadmap when every second counts. But then there are the street smarts, the how. These are the lessons you learn at 3 a.m. in the back of an ambulance, or when you try to piece together a patient's story from a scene that doesn't make sense. Street smarts teach you how to apply that knowledge when the patient doesn't fit the textbook, when resources are limited, and when things inevitably go sideways. The best EMS providers have both. They can think critically because they understand the why, and they can adapt creatively because they've mastered the how. Together, book smarts and street smarts make a well-rounded provider, one who can read the patient like a book and still write the ending when it doesn't match the chapter. In this job, knowing both doesn't just make you a better medic. It might be the reason someone goes home tonight. Book smarts give you strong theoretical knowledge, the kind that helps you break down pathophysiology, explain treatments, and sound like you've got it all figured out at the case review. It's the part that lets you follow protocols precisely, understanding not just what the next step is, but why it's the right one. And sure, maybe it's the part that also helps you win at who can answer the instructor's question first during training. Booksmart providers are skilled at interpreting test questions and clinical data. They see patterns, connect the dots, and know the right answers. Not just because they memorize them, but because they understand the underlying concepts. That's the part that helps you nail your exams and impress your medical director. And when it comes time to explain what's going on with your patient to a partner, a nurse, or that one know-it-all family member at the scene, this knowledge lets you do it with confidence. Just remember, all the book smarts in the world won't help if you can't also apply them in the chaos of the real world. Because as we all know, the patient didn't read the textbook before they called 911. In EMS, some of the best tools you have aren't in your bag. They're in your head. The best providers stay calm under pressure when the scene is falling apart, when the patient is crashing, and when every bystander suddenly has a medical degree from WebMD. They don't freeze when things go sideways, and they don't panic when the textbook answer doesn't fit the patient in front of them. They're innovative and adaptable when equipment or resources are limited, because sometimes all you have is duct tape, a pair of trauma shears, and sheer force of will. They're excellent communicators, able to connect with patients, families, teammates, and other first responders, making order out of chaos. And when seconds matter, They assess quickly and make sound decisions, relying on both experience and training. They recognize when it's time to stick to the protocols and when it's time to throw the book out the window. In EMS, being calm, adaptable, and sharp isn't just a nice trait. It's the difference between a patient making it to the hospital and one that doesn't. These aren't just soft skills, they're survival skills. And in this line of work, that's what separates a technician from a seasoned provider every shift, every call, every time. In EMS, book smarts and street smarts aren't competing forces. They're two sides of the same coin, and together, they're what save lives. Book smarts make sure patient care is rooted in evidence-based practice. They give you the roadmap, the protocols, the pathophysiology, the why behind every treatment. They're the foundation that allows you to walk into any scene and understand what you're dealing with. But street smarts? That's where theory becomes practice. It's making patient care tailored, practical, and effective, regardless of the scene, the patient, or the resources available. Street smarts teach you when to adjust, when to adapt, and when to trust your gut because the patient didn't read the book before calling 911. When you combine both, that's when the magic really happens. Together, book smarts and street smarts lead to safe, efficient, patient-focused outcomes. They help you bridge the gap between what you learned in the classroom and what you're seeing in the field. In EMS, knowing the science is vital, but knowing how to apply it when it's midnight, raining, and your patient doesn't fit the textbook, that's the difference between doing the job and doing it well. And it's what makes a great EMS provider. In EMS, you'll find yourself relying on both book smarts and street smarts, sometimes in the same shift and sometimes in the same call. Book smarts are what help you spot that rare cardiac arrhythmia buried in a 12-lead ECG, the one that doesn't fit the usual patterns but can kill your patient if you miss it. Street smarts are what help you manage the scene when the patient with that rare arrhythmia is surrounded by screaming family, multiple other patients, and enough bystanders with camera phones to make it a live stream. It's one thing to understand pathophysiology and recognize a bad rhythm. It's another to coordinate resources, maintain scene safety, and make sound clinical decisions when it feels like the wheels are falling off. The best patient care doesn't come from relying exclusively on one or the other. It's a blend of both. Book smarts guide your clinical reasoning, making sure you're doing the right thing for the right patient. Street smarts ensure you can apply that knowledge when every scene is unpredictable and every patient is unique. In EMS, knowing the why and mastering the how is what separates a technician from a true provider. And often, it's what separates life from death. In EMS, learning doesn't end when you leave the classroom. To stay sharp, to stay safe, and to stay effective, you've got to stay current. That means keeping up with the latest EMS literature and protocols, understanding what's new, what's changed, and why it matters for the patients you treat every shift. It means committing to continuing education throughout the year, making sure your knowledge and skills evolve with the profession. New treatments, new equipment, new evidence. It's all part of providing the best care possible when seconds matter. And don't wait until just before your recertification is due to play catch-up. Set a monthly goal for obtaining hours and stick to it. Remember, it's not just about checking a box. It's for you and for your patients. They're relying on you to make the right call when it counts. And it means putting that knowledge to the test. Practice questions and case studies aren't just exercises for a test. They're a chance to run through the scenarios that might be waiting for you tonight. Stay sharp, stay current, stay ready. In this line of work, knowing the right answer is one thing. Making the right decision when it matters is what separates the best from the rest. In EMS, some of the best lessons you'll ever learn don't come from a textbook. They come from the people who've been there before. Learn from veteran EMS colleagues. Listen to their stories, ask questions, and watch how they work when the pressure's on. Those moments can teach you more than any lecture ever will. Then practice. Practice scenarios, run simulations, and rehearse the things you hope you'll never have to do for real. The more you train, the more prepared you'll be when it counts. It's in these moments that theory becomes second nature, And what if becomes I've got this? Reflect on your calls. Learn from your wins and, especially, from your mistakes. Every patient, every scene, every shift has something to teach you if you're willing to listen. Stay humble, stay sharp, and stay hungry for knowledge. And finally, focus on teamwork and connections. EMS is a team sport. Knowing your role, supporting your partners, and communicating clearly can make all the difference when the scene is falling apart. In this job, it's the connections you build and the lessons you carry with you that make you a better provider and that help you get your patient and yourself home safe every shift. Knowing what to do is only half the battle. Knowing how to do it when it really counts is what separates a technician from a seasoned provider. The best EMS professionals combine clinical knowledge with hands-on experience, using what they've learned in the classroom and adapting it to the unpredictable nature of the field. They can shift gears quickly when things change, making decisions on the fly while still following the protocols that keep patients and providers safe. They're able to read the scene, adjust to new information, and stay calm when the pressure is on. These providers also understand that how you communicate is just as important as the treatments you give. They build trust quickly with patients, families, bystanders, and teammates, making connections when every second counts. At the end of the day, it's this combination of knowledge, experience, and compassion that delivers the best patient care. Care that's safe, thorough, and genuinely human. In this job, knowing your stuff is vital, but knowing how to apply it with a steady hand and a calm voice, that's what makes the difference between getting through the call and making sure everyone, patient and crew alike, goes home safe. In EMS, book smarts and street smarts aren't competing ideas, they're partners. Together, they form the foundation for a proficient, adaptable, and confident EMS provider. Book smarts give you the knowledge, the why that guides every clinical decision. Street smarts give you the how, the ability to apply that knowledge when every call doesn't fit the textbook, when resources are limited, and when seconds matter. The best providers understand that you can't have one without the other. True mastery of this craft means cultivating both throughout your EMS career. Stay sharp in the classroom and in continuing education. Stay sharp in the field by learning from every call and every veteran medic you work with. Never stop refining both sides of your skill set. At the end of the day, it's this balance that separates a technician from a seasoned EMS professional. It's this balance that allows you to walk into the unpredictable, a messy scene, a scared patient, a crisis that doesn't wait, and stay confident, adaptable, and focused. In this line of work, knowing what to do is vital. Knowing how to do it when it counts is everything. Aim for both every shift, every call, every step of your career. Thank you for viewing this presentation. We hope this information has been helpful and inspires you to continue learning and applying these best practices. To further your continuing education journey, visit easymsu.com. We currently offer over 50 hours of CU courses for EMS professionals of every level, including free courses as well as a yearly subscription for just $25. Check for a link in the video description below.